Hello everyone, I'm psychologist Izit Galu. Today, we're going to have an in-depth conversation about psychology, particularly bipolar disorder. There are many misconceptions and labels surrounding bipolar disorder, which shape how people perceive their psychological processes. But there's something crucial we need to do: develop our ability to live with issues as if they don't exist, rather than trying to eliminate them. Many people tend to view emotional struggles as diseases, and this affects both their treatment and personal perceptions. But is our psychology really swinging between two extremes? Or are we the ones enlarging these extremes? Let's explore these questions and more together. Today, we will talk about everything from depression to manic episodes, how these conditions are perceived, and how we can develop a healthier perspective on them. What should be done? Psychology is an important process if you care about it, and it is an insignificant process if you do not. Living as if something doesn't exist destroys it. Instead of trying to destroy it, we should develop the capacity to live as if it doesn't exist. If you don't focus on problems, they won't focus on you either. The difference between a problem experienced correctly and a problem that has never arisen is as vast as the difference between apple cider vinegar and grape vinegar. If a problem looms large in your mind, it will grow in your soul. If a problem shrinks in your mind, it will shrink in your soul as well. First, always seek answers to these questions. What is bipolar disorder? It means a mood disorder with two extremes. So, what do the two extremes of mood mean? Does your psychology truly fluctuate between two extremes? Does disorder mean illness? What test or examination diagnosed you with this? Why doesn't physical medicine start treatment if no illness is found in tests? What test showed bipolarity? Is the problem whether or not you have bipolar disorder, or is it whether or not you believe in having it? When you say they are bipolar, their psychology is bad, is it the bipolar disorder, the belief in bipolarity, or the heavy medication that is responsible for that mental state? How well can you make this distinction? What can threats do to someone who is willing to face death? A threat only creates fear in someone who is afraid of death. And even if one were bipolar, so what? If it's a medical illness, why is there no test or examination for it? If it's not an illness, why do we assign it so much exaggerated meaning? You've always identified with this perception and lived by saying, I am sick. Try living for a while with the belief that I am not sick and activate the mechanism of living as though it doesn't exist. Even if you're seeking help, let it be to develop your capacity to live as though it doesn't exist. You can't get a different result by taking the same path. You've tried to get a different result by following the I am sick path, but it didn't work. Change the path just once. Let's say you've entered a depressive phase. You haven't entered the Mariana Trench of the Pacific Ocean. If you did, you'd get out again. We're willing to endure the severe side effects of medication, but why are we not willing to endure the emotions caused by psychological issues? When medication causes effects, we say, be patient, it will pass, but when life brings it, we say, don't ignore it, rush to treatment. Take medication for life. Is bipolar difficult? Or is the psychology caused by the heavy medications used to treat it difficult? Let's say you entered a manic phase. Is that phase truly manic? What do you do in that phase? A manic phase means an overly exuberant mood. Is your mood overly exuberant? First, it will be exuberant. Then, it won't be enough. It will be excessively exuberant. Is your mood exuberant to begin with, for it to become excessively exuberant? Think of it like a river overflowing, like a glass spilling over. In my 25 years of professional experience, I've seen hundreds of people diagnosed with this, but I haven't seen even one person with an exuberant mood. What they call depressed is not really depressed. What they call manic is not manic, and what they call bipolar is not truly bipolar. But now, this diagnosis is everywhere. I repeat, which excessive exuberance do you experience in this so-called manic phase? Is what you're experiencing truly excessive? Excessive according to what or whom? Let's assume it's excessive. Live through a manic phase for a while, so what? Does your mood always have to stay stable? Is it too hard? Is the grief of losing a child easy? Is yours harder than losing a child? They live with that pain until they die, but yours is a temporary phase. When psychology becomes difficult, does it always have to be labeled as a disease? Why do we keep making the problem bigger in our eyes and minds? Why do we add the belief I'm bipolar and all the heavy medications as a complication on top of the existing effect? Is all the psychology we experience solely due to bipolar disorder? Are we sure about that? In such cases, you can get perception training and correct coding support from my YouTube videos.
Ask yourself these questions at least once a day. Is the thing affecting me truly bipolar? Is it my belief in being bipolar or my bipolar perception? Or is it the heavy medications I'm taking? Doesn't the belief I have cancer create a psychological state, but I'm bipolar doesn't? Does only illness create psychology? Could it be that by assigning all the blame to bipolar disorder, we're enlarging this problem first in our minds and then in our souls? This sector consumes, and it loves to make you pay the price. It gives you the strongest medications that cause suicidal thoughts, and when the person commits suicide, they say they had psychological issues and get off scot-free. They place the blame on psychology. This is such a sector that a 5-minute diagnosis and treatment process is considered legitimate under the excuse of we're short on time. Have you ever seen a surgeon finish a 1-hour operation in 5 minutes under the excuse of we're short on time? If you ask, they'll say mental health is just as important as physical health. You can read these explanations once or twice a week and send them to your subconscious through visual reinforcement, making it more effective. Most importantly, take the maybe axe in your hand again and start striking the body of what is called a problem tirelessly. Other explanations aim to convince the mind rationally. The maybe strikes are the most effective suggestion, axe, blows for the problem perception, the tree. Don't struggle with the wave, just let yourself float. They make you struggle with the wave. Then, when you're exhausted and ruined, they say, look, the wave destroyed you. Think about these again and again. Does my mood truly fluctuate between two extremes? Is fluctuating between two mood states a pathological problem? Why am I concerned with symptoms when a doctor isn't after the test come back clean? What tests were conducted when I was diagnosed with bipolar disorder, and what pathology was found? Is the reason I'm affected by a mouse because of the mouse itself, or my perception of the mouse? Am I affected by being bipolar, or by my bipolar perception and belief? Depression, the bounce of sadness. Grief, sorrow, and distress are emotions. When they're called depression, it first becomes a disorder and then, in the blink of an eye, a disease. That's why they've medicalized emotional processes and given them clinical names. What they call anxiety is the feeling of discomfort. What they call depression is the feeling of grief, sorrow, and sadness. What they call panic attack is the feeling of fear. From 3 basic emotions, they've created 300 types of psychiatric disorders. Even world-famous bolu manjen chefs can't make 300 dishes from just 3 basic ingredients. They say if the feeling of sorrow, grief, or distress is light, it's mild depression. If these are excessive, they call it major depression. If these fluctuate, they call it bipolar disorder. If these symptoms are not present, they call it masked depression. If these symptoms are present but don't match typical depression signs, they call it atypical depression. Whether depression is present or not. If it is, but doesn't match, it's still depression. If it's stable, it's depression. If it's variable, it's still. They've covered all the paths. The only thing left to avoid being diagnosed with depression is not to visit these clinics. Just going to these clinics has become the basic secret diagnostic criterion. How many people have visited these clinics without receiving a clinical diagnosis?
A psychiatry professor was asked, why has depression increased in recent years? His answer was, the capitalist world, increased loneliness, more alienation. But when you go to his clinic, he'll immediately say, your serotonin is low and push medication. The reason depression is widespread is shown as environmental on-screen and brain-based in the clinic. Another famous psychiatry professor says on-screen, automatic thoughts are very important in depression. Then, initially, we give medication. If necessary, we'll bring therapy in later. Automatic thoughts are important, but medication is the primary treatment, and therapy comes in only later if necessary. Thank you so much for watching the video. Remember, not every psychological challenge has to be a disease. Understanding our mental health correctly and taking the right steps often begins with the awareness of I am not sick. If you'd like to learn more, you can keep watching my videos or take advantage of the educational content I've prepared for you. When facing psychological challenges, we don't have to let them grow. Instead, we can learn to live as if they don't exist. Developing the right perspective and healthy beliefs while doing this is very important. Together, we can learn to manage our psychology in a stronger, healthier way. I hope to see you in my next video. Take care of yourselves, and goodbye for now.